Good morning and welcome to Inspire for MST Orientation and Refresher Training. This training is for anyone who is new to Inspire or perhaps has been using Inspire for a while but was never actually trained, or for users who have participated in training before but just feel the need for a refresher. So my name is Liz Campbell, and I am part of the Inspire team at the Penn State Epicenter. Just a quick order of business before we get started. If you need help or have a question during today's training, you are currently should be in full screen mode in Adobe Connect, meaning that the PowerPoint that you currently see should take up the entire screen. In the top right corner, there is a button that says full screen, and if you click that button, you'll exit the full screen mode, and you can actually use that button to switch back and forth between full screen mode and partial screen mode. And if you click out of full screen mode, there is a chat pod that you can use to ask questions during today's training. So if you have a technical question or you're having problems with Adobe Connect, my colleague Tanya is also in the training and will answer those questions for you. If you have a general question about Inspire, I'll try to answer those as best I can during the training. And if you have a question that is really individual or provider specific, feel free to type your question in the chat pod and I'll follow up with you after the training. So the plan for this morning is that we'll start with just a really brief overview of what Inspire is and how it works, because I think that background is important to users. And then we'll walk through the data entry screens, and we'll be focusing a lot on how to answer the questions that are asked. And then we'll wrap up with an overview of how to run and submit quarterly reports. So, what is Inspire? Inspire is a program that allows agencies to easily collect, store, analyze, and communicate their data. The goal with developing Inspire was to allow there to be more consistency in the data collection and outcome analysis across providers in Pennsylvania and across the evidence-based programs. So Inspire exists not only for MST, but we also have an Inspire system for functional family therapy and multidimensional treatment foster care. This allows state policymakers and funding sources to have more accurate and reliable data. So before Inspire existed, there really wasn't a way for us to easily roll up statewide data on these programs that the state is supporting and investing a lot of funding into. And oftentimes when we would ask providers for their outcomes, we would get it at a really global level, and different people were answering questions in different ways. So if asked how many youth were successfully discharged from your program, every agency would answer that question with a different definition in mind. So part of Inspire was trying to create more consistency, and we're comparing more apples to apples across the state. And all state-funded MST programs are expected to use Inspire. So that could be state funding through medical assistance or coming through the county needs-based budget. So Inspire was developed by the Penn State Epicenter in collaboration with the Penn State Department of Engineering. It was part of our grant from the Pennsylvania Resource Center for Evidence-Based Prevention and Intervention Programs and Practices to develop Inspire. And so we do generate quarterly and annual reports to them from the data that goes into Inspire. And that resource center has membership from a number of different state offices and agencies, including the Office of Mental Health, the Office of Children, Youth, and Families, the Juvenile Court Judges Commission, the Pennsylvania Commission on Crime and Delinquency, the Department of Education, and so forth. So all of those agencies see the state level data that comes from Inspire in terms of how is the program being utilized, what kind of outcomes are we achieving, what's the implementation quality. At the local level, managed care organizations and county stakeholders can ask for copies of a provider's Inspire report. And we're seeing that happen more and more as those entities become aware that Inspire exists. So we do now have managed care organizations that, for instance, expect their MST program to share a copy of their Inspire report quarterly or at the end of each year. Agencies might proactively use the data to demonstrate their outcomes to funders and to stakeholders. And the data is used, as I mentioned a moment ago, the data that goes into Inspire produces reports that look at things like how well the service is being utilized, how many youth are being served, what kind of outcomes are being achieved, both at discharge and at 6-month follow-up, and what is the implementation quality. So the reason that I provide that background as we get ready to talk about how to enter data into Inspire is to emphasize that even if you're not seeing the Inspire report, even if your role is to enter the data for your clients and somebody else kind of handles the report end, the data that goes into the system is really important. And so it's really critical that the data is accurate and that folks entering the data understand what the questions in Inspire are asking. The data in Inspire comes from 2 sources. And this is another piece that's just really important to understand as you get ready to work in Inspire. Data from the MST Enhanced website. So that's the data that, as MST providers, you're already entering data into that national system. Data from that MST Enhanced website gets integrated with Inspire every month. So the data that you enter into that system actually gets downloaded on a monthly basis into Inspire. And that way, you don't have to enter that information in 2 places. Inspire users will get an email every month when that happens. So you'll receive an email that just says integration has occurred. And then there is data that is entered directly into Inspire because we can't get everything we need for the state outcomes from the MST Enhanced website. So there are a few questions at enrollment and at discharge that go directly into Inspire. And then as we'll see, there's also a follow-up screen to enter follow-up data because none of that is available right now in the MST Enhanced website. What Inspire does is Inspire uses the case ID to match up the data that comes from the Enhanced website with the data that you enter into Inspire. So by using the case ID and seeing these 2 IDs match, Inspire will know that this data from the Enhanced website is for the same youth as this data from Inspire. So as we'll talk about, making sure that case ID is correct is really, really important. And then when a report is run, it pulls from both sets of data. So all that data that went into the Enhanced website and the additional data that was entered into Inspire all gets used to create the Inspire report. There are 2 types of Inspire user accounts. So depending on what your role is with Inspire, you may have 1 Inspire account or you may have 2 accounts because you may be filling both roles and need both types of accounts. One is a clinical or therapist account, and that account will give you access to the client data entry screens. So that's where you go in to enter enrollment and discharge data and so forth. The other type of account is an administrator account, and that login gives access to the screens where one would run reports or manage user accounts. And so if you have both types of accounts, you'll actually have 2 separate logins. The usernames are automatically generated by Inspire, so it will typically be your last name followed by a number. But once you are in Inspire, you can go to the drop-down menu in the top left corner and select Change Username and Password from the drop-down menu. And you can change your username and your password to be something that is meaningful to you and easy to remember. There are a number of Inspire resources that exist. And I will click over to our Inspire resource page. You'll see the link here for the resource page. Here is the MST Inspire resources page. You'll see a lot of the information we're going to cover today is actually included in our online resources, which are always there for you. You'll see that there's a resource for understanding your Inspire report, which explains how all the definitions work and how all the data is calculated. There's a protocol for submitting the quarterly reports, frequently asked questions. And these are especially important. There are screen guides on our website that walk through how to answer the questions in Inspire, troubleshooting frequent problems, and so forth. And there are also data collection worksheets. So like, for instance, the enrollment worksheet has a list of a few questions that map directly onto what needs to go into Inspire. So those are just ways that providers can develop a system to easily collect that data from their therapists and then pass that on to be entered. I do want to just quickly show you the screen guide, just so folks know what that looks like and why it would be a useful resource. This is an example of the screen guide for the clinical users. And you'll see from the table of contents here that it includes a lot of useful information, including frequently asked questions and troubleshooting. And here we have all the data entry screens. So there's information on how to change or delete a case, the enrollment screens, and that goes through all the enrollment questions, discharge follow-up, and so forth. So you can always go back to that resource if you have a question or can't remember something from today's training. You might very well be able to find it in there. All right, so let's log into Inspire and get going, and you can see how this thing works. This is the testing site that I'm going to be walking you through, or the demonstration site, but it looks very much like the live Inspire site. I believe when you get set up with your username and password, that email will include a link to the Inspire login page. But you can also find the link to that Inspire login page right here on our resource page. So the first page is where you would log in. You'll see here the username and password, and if you have trouble logging in, there's a place to click to submit that information. I would say 99% of the time when there's difficulty logging in, the person has forgotten their username and password, and I can easily go into Inspire and have the system resend you that information. So you would simply type in your username and password and sign in. I'm starting with a therapist login, a clinical user login. So we're going to walk through what a clinical user would see and what the data entry screens for client data entry look like. One important piece of information I just want to mention is that as you're navigating through the Inspire system, you do not want to use these buttons up at the top, the back button or the refresh button. If you use those buttons while you're in Inspire, it will kick you out of the system and you'll have to log back in. So always use links and arrows right here within the actual Inspire page to navigate through the system. All right, so we're going to start by going to the enrollment screen, and you'll see here in the top corner client data entry, and there's several screens to choose from. Account management, username and password, that's where you would go to change your username and password. Change or delete case ID or name, that's where you could go if you needed to change or delete a case ID or name. And similar to on the login page, there is a link up here in the top right corner for reporting a problem. So if you run into an issue while you are in Inspire, we really encourage users to use that link and let us know immediately what the problem is. Otherwise, it can be really hard if someone mentions a couple weeks later, hey, I was in Inspire and this really weird thing happened, or I was having difficulty. And at that point, it can be hard to remember exactly what happened. But the more details we have at the moment, the easier it is for us to help you out and figure out what the problem is. So let's get started with the enrollment screen. All right, so you'll see here on the enrollment screen, at the very top, there are two ways to identify which case you want to enter enrollment data for. I mentioned a moment ago that data from the MST Enhanced website is integrated every month with Inspire. So if you enter a youth into the MST Enhanced website, and then you wait until after the next round of data integration to enter that youth's data in Inspire, you'll find that youth in the drop-down menu of existing clients. So when that monthly data integration happens, all the youth that are listed as enrolled in the MST Enhanced website for your site, for your provider agency, will show up in this drop-down menu. Because I'm on the demo site, there's only one client right now. That's just a test client that I made up and put in there. The other thing you can do is if you want to immediately enter that client into Inspire after entering their enrollment data in the Enhanced website, is you would click New Enrollment Type, and you would type in a case ID. And you would type in a name. Oh goodness, we'll just do Scooby-Doo. We like to do cartoon characters. It would be, this is where making sure that you're entering the same case ID from the MST Enhanced website is really, really important. And this is not the case ID that your agency has assigned to that youth. This is the case ID, the unique case ID that the MST Enhanced website has generated and assigned to that youth. Those case IDs that are generated by the Enhanced website are never duplicated. So even though we have 14 MST providers in the state, if you use that case ID, it will always be unique to that individual child. If by chance you enter the wrong ID and you need to go back and change it, you can do that under the MST drop-down menu where it says Change ID. The one other thing I would mention here is if you have a youth who's been in MST more than once, let's say this is their second episode of MST for some reason, that youth will actually be listed twice because the Enhanced website gives them a new case ID each time they are enrolled in MST. So you'll want to make sure to select the correct case, use the correct case ID for this current episode of treatment when you're entering their data. The first question here is whether or not the youth is at risk of placement right now. We ask that you respond to this question based on information that was available at the time of referral or intake, preferably using information from the referral source or the agency that would have the authority to place the youth. But the program supervisor or your intake staff should make the final determination on this, knowing your community, the placement trends, and how that typically works where you live, determining if this youth is at risk. So out-of-home placement would really be any placement out of home in foster care, the juvenile justice system, mental health, drug and alcohol treatment, anything that would remove the child from their home. The youth is stepping down from out-of-home placement is pretty self-explanatory. This youth is returning home. Where folks sometimes get a little more confused is between whether the youth is at immediate risk of placement or not. And we ask that you limit this question. The program is being used as a diversion from placement. Youth is at immediate risk. For youth where MST is really being used as a last step before placement or instead of placement, these are the kids that if they don't do well in MST, they're probably going to end up being placed. right away. Not, well, if this kid doesn't do so well, they're on a bad path, eventually they could end up reaching a point where they have to be placed. We're talking the kids that, the judge is saying, I'm court ordering you to MST, and if you don't do well, you're going to placement. So in this case, for Scooby-Doo, we'll say that Scooby is at immediate risk of placement. The next is a list of presenting problems identified at intake. And again, this should be based on information that's available to you at the time the youth starts treatment, information from the referral source, from members of the ISPT, including the youth and caregiver. We know that sometimes in the course of treatment, therapists will learn about new problems that maybe were not identified at intake. We ask that you answer all of the enrollment questions based on your understanding when treatment starts, and you don't need to go back and change them if you have different information 8 weeks in. This way we're really capturing a snapshot of what this youth looks like at intake based on the information available at intake. So we'll say here that we have a youth being referred for truancy, some physical aggression, and some running away overnight. You'll see here it specifies overnight. So if a kid disappears for a couple hours in the afternoon and then is back home, that wouldn't be counted here as running away. And if you have another issue that's not listed anywhere here, you can click Other and type that problem in. The next item here is the county of residence, and it is extremely important that you answer this question. The information available in the enhanced website only gives us information about the zip code that the youth lived in. There's a great number of zip codes that actually overlap and span 2 counties. So we aren't able to use the zip code to accurately identify which county a youth is from. We are currently in the process of developing the ability to run reports by county, by referral source, which means that in the coming months, hopefully very soon, administrators will be able to go into Inspire and say, hey, we serve 3 counties, but I want to run a report that only includes the kids referred by Adams County Juvenile Probation. If those kids haven't had their county selected in the enrollment screen, that report's going to look like there weren't very many kids served from Adams County Juvenile Probation. So it's really important that every single youth has their county of residence selected. And that way, when your program goes to run a report for a specific county, all of those kids will show up in the report. So here we'll just say Adams County. You don't have to enter the referral source because that information is in the enhanced website. Inspire gets it from there. And the last thing that's asked at enrollment is the caregivers who will be involved in treatment. And this again is at the point of intake, how many caregivers, who do you expect will be participating in MST with this youth? It should only be caregivers, so don't count an adult who lives at the home but isn't actually a caregiver. So let's say mom's best friend is currently staying with the family and is there, but really isn't in a caregiving role, isn't going to be participating in MST. You wouldn't list mom's best friend there. However, if grandma who lives down the street and often, the youth is often staying at grandma's home, is going to be participating, or you anticipate getting grandma involved in treatment, that is an adult who sometimes plays a caregiving role and is going to participate, you would list grandma there. If you prefer to just put initials, you can do that. You don't need to put the full name. I know sometimes folks have some qualms about doing that. That's fine. You can just put initials if you like. The really critical part is to make sure you select the relationship to the youth from the drop-down menu, because that is what Inspire counts to determine how many caregivers were involved in the youth's treatment. So make sure that you do select the relationship to the youth. Okay, and when you're all done with these questions, and you'll see there's really only 4 questions to answer on the enrollment screen in Inspire. When you're all done, make sure you hit the submit button. If you don't hit submit, the data won't go into the system. So you hit the submit button, and you'll see this screen that says your data is successfully saved. Thank you for your time. And that means your enrollment data for that youth is in there. All right, so we will go on to discharge. So here again, you'd go to the drop-down menu in the top left corner, and you would select discharge from the drop-down menu. At this point, the youth is already enrolled, presumably, or they wouldn't be being discharged. So you will select the youth from the drop-down menu. There's no place to manually enter a youth at this point, because the list of kids that might have discharge data is just coming from the list of kids who've been enrolled. So here we will enter some discharge data for Betty. And you will see you can sort your list by name, or you can sort it by case ID. Whatever is easiest for you. And if you start to type the youth's name in here, I typed B for Boop, the client will pop right up. So you don't necessarily have to go through that big list. If you have a program that's been in place for a long time and has served a lot of youth, that drop-down menu can get really long. You can just start typing in the case ID or the name, and it should pull that youth up for you. You'll notice here on the side it says Inspire discharge data is submitted. MST discharge data has not been integrated yet. And this will indicate for you, you'll actually see I already entered discharge data for this client. So it's saying that her data has already been submitted. That's not to say that I can't make some changes to it now and resubmit it to the system. And then it's saying here that her discharge data from the MSTI, from the enhanced website, has not been integrated yet. So if I run a report right now, her discharge data from the MST enhanced website won't be included in that report, only what I've put in here. And that actually means that she won't be included in the discharge report at all, because her discharge date, which tells Inspire to include her in the report, her discharge date is coming from the enhanced website. So you can see where those two systems really need to be working smoothly together. All right, so here we have Betty's discharge data. The first 2 questions ask whether the youth was satisfied with the program and whether the parents and caregivers were satisfied with the program. We do not want this question answered based on therapists' impressions of whether or not the youth and caregivers were satisfied. So this shouldn't be, well, yeah, I think Betty's parents really liked MST. I'll click yes for that. We don't want it answered in that way. We're asking that programs would answer these questions using something like a satisfaction survey, if you did exit interviews with the family, or some other specific tool that's completed when the youth is discharged from the program. If you're using some type of satisfaction survey that, let's say, your agency uses as a whole when clients are discharged, we would suggest that there's a consistent threshold score established. You could talk to your administrator or supervisor about what that should be, so that you can determine at what point is this counted as a satisfied youth or family versus a dissatisfied youth and family. And it's not up to the person entering the data to look at that survey and make a judgment call. We don't want these to be judgment calls. And if you don't know this information, you simply leave that question blank and you wouldn't answer it at all. So the next item here is whether the youth achieved the goals on his or her treatment plan. We would ask you to answer yes if the youth met and family met most or all of their goals from the treatment plan. If your program has worked with your stakeholders to establish a specific criteria for when to consider goals met in a case. Like let's say in your plan with your stakeholders, the target is that youth will meet 80% of their goals. Then you can use that as your definition for answering this question as well. The next two items here have to do with whether the youth showed improvement in school attendance during his or her time in the MST program, and whether they showed improvement in academic performance. This question is based on the therapist's clinical judgment of whether the youth demonstrated improvement in this area. And you would answer this regardless of whether that was a presenting problem for that youth. So if you have a kid who didn't have problems with school attendance when they came in, and still didn't have problems when they left the program, you would just mark no change. That is not going to hurt your outcomes in any way. And similar for academic performance. If you had a youth who came in, they were making B's and C's, it wasn't identified as an issue, they were still making B's and C's, just mark no change. If that youth was then making A's when they finished the MST, you would, of course, mark them improved. And if their grades had worsened, you would mark worse. This next question here is about substance use. There's actually the next two questions are about substance use, but coming at it from really different ways. So this first item here is based more on the therapist's judgment and the range of information available to the therapist about whether this substance use changed while they were in MST. You'll notice it says that you can answer this question using the therapist's clinical judgment, reports from the client, the family, key participants in treatment, including the referral source, whether there are some kind of emotional or behavioral signs that this youth is using, and the results of any known drug screens. So you're really taking all of that information together that you have available to you as the clinician and answering this question. Please note that we do not count tobacco use here. So do not include that when you're thinking about this. And you're also basing your answer on the last 2 months of treatment. So those last couple of months, what did the youth's substance use look like? Was it eliminated? So there's no signs of active use. Was it occurring less intensely or less frequently? So this is a youth who used to be smoking pot with their friends every day after school. Now they're only doing it on Saturday evening. Or this is a kid who was binge drinking on the weekends, but now she, admits that she's still drinking, but she's not binge drinking. She's having, 1 or 2 drinks instead of getting really wasted. Continued with no change, increased, or this is a youth with no history of substance use. And then, last but not least, has the youth had any drug screens for which you know the results? So if the youth had a drug screen from, let's say, their JPO, or you worked with the family to have encourage the parents to get the youth drug screens, and you know the results, you would click yes. And when you do that, this little menu will pop up where you can enter the drug screens. Again, you only enter it if you know what the results were. You would enter the date of the drug screen here. We'll just say that it was on Monday. Now, if you don't know the exact date, so let's say, for instance, that you know that this youth's JPO did a drug screen and that the youth had a positive drug screen. You don't know the exact date, but you know it was last week sometime. Then you could pick Wednesday. Just pick the middle of the road day of that week. If you really have no idea when the drug screen was done, the JPO says, yeah, I did a drug screen a couple of months ago, you wouldn't enter it because you just don't have a specific enough time frame to narrow down and put the date in. You would say this, let's say this youth's drug screen was positive. Was it court ordered? We'll say no. And completed by, there's actually codes up here to use. So for instance, let's say the JPO did it, we would just enter a 2. in that field. Please don't type in a name or a person because the system won't be able to do anything with that. And then if we wanted to add another screening, we would just hit add screening. The one other thing I just want to mention about the drug screens is if you need to delete a drug screen, you'll notice you can kind of highlight back and forth between the rows. Make sure that you've highlighted, clicked on the row you want to delete, and then click delete screening. Otherwise, the system will just default delete whichever row you happen to have been using last. So you want to make sure you select the correct row before you hit delete. And that is it for the discharge screen. So I'll hit submit here again. And again, we see the screen that says data has been successfully submitted. I'm going to answer a couple of great questions that came up here. One is, and I think this speaks to the enrollment screen. If you have an ID from the MST website, wouldn't this information already be in the Inspire database? And I am assuming the question has to do with the name and the ID, and the answer is yes, as long as you wait until after data integration to go into Inspire. So remember that when you enter something in the enhanced website, it does not immediately get added into Inspire. We don't have an automated system for those two systems to communicate with one another. So when you enter the information into the enhanced website, you're going to be waiting until we do data integration, which usually occurs between the 7th and the 10th of the month. And when that data integration occurs, now that kid's data will be pulled into Inspire. So if you go, for instance, we just had data integration on November 8th. So if you went in and entered a new youth on this Monday, on the 18th, November 18th, if you go into Inspire, that youth will not be in Inspire yet because integration occurred on November 8th. That youth was entered in the enhanced website on November 18th. You won't see him or her in Inspire until integration occurs again between December 8th and 10th. So providers make different decisions about how they want to handle that. Some providers will say, well, we're just going to wait until after monthly integration occurs. We'll use the data collection worksheets. When we enter a youth into the enhanced website, we'll fill out that worksheet and we'll kind of keep a stack of those. And once we get the note that integration has occurred, we'll take that stack of worksheets and we'll go enter them in Inspire because now those kids are showing up in the drop-down menu. Other providers would say, you know, we're going to enter the youth in the EWS and we're going to go enter them into Inspire right away. And by doing that, they're going to need to enter the youth's information, their case ID, and their name manually because there wouldn't have been time for the information to transfer over. And the second question was around the drug test. Would it include over-the-counter test kits or does it have to be from a medical lab test result? That is a really great question that we actually have not been asked before. And I would say either one. So if you have an over-the-counter test kit that, let's say, the parents used, you can certainly still enter the results in. Great questions. And please, again, if other folks have questions, feel free to type them into that chat pod and I'll try to check periodically and make sure I answer them. All right, so now we're going on to the follow-up data. And again, here in the screen, you'll see there's a place to select discharge follow-up from the drop-down menu. I'm aware that not all sites currently collect follow-up data. So if you are currently collecting follow-up data, we would really encourage you to enter that information into Inspire so that it is included in your Inspire report. If for sites that are not collecting follow-up data right now, we really encourage sites to start doing that because of course, one of the things stakeholders often ask is, well, gosh, this is great. The kids are doing well when they're discharged. You know, 90% of the kids were still at home and they hadn't recidivated. But how are they doing after? You know, what do they look like 6 months down the road? And right now we don't have a whole lot of data to answer that question. So it really depends on sites doing that follow-up data collection and getting the data into the system. And I think the more we build up that, the data that's available, the better we'll be able to talk about how well is MST in Pennsylvania achieving sustainable positive outcomes for youth. We know that the research shows that MST has positive long-term outcomes. But there's always this question of, okay, what about in our community? Are we getting those good outcomes? And that's a very valid question for stakeholders to ask. Are the great outcomes that were found in the research also being achieved in our community with our program? So for follow-up in MST, you can enter follow-up at any point. In the report specifically pulls follow-up data for 6-month follow-up. So if you do a 3-month follow-up or a year follow-up, it won't show up in the report. And so the 6-month, it has to be 6 months out from the date of discharge. And actually, more specifically, it has to be, there's a window of time. So the follow-up interview or follow-up data collection needs to be within 149 and 211 days of discharge in order to be counted in the report. And there's a great website. It's timeanddate.com. So timeanddate.com. You can enter the youth's discharge date and then calculate out, well, what's 149 days from this, or what's 211 days from this, and it'll give you that date. So you'll know, because often what folks will say is, well, we entered youth discharge data and none of it showed up in our report. Or I'm sorry, we entered the follow-up data and it didn't show up in the report. And oftentimes it's because the date didn't fall in that window of 149 to 211 days from discharge. So let's see here. Betty's got her discharge data in there, so she shows up in the follow-up menu. The youth won't show up in the follow-up menu until they have their discharge date. Let's see here. And actually, if you enter, I'll add this, if you enter the youth discharge data in Inspire, but the discharge data has not been pulled yet from the enhanced website, you may see the youth in the follow-up drop-down. And actually in the live site, it will have their discharge date over here next to their case ID. It may say something like January 1st, 1900, and that means that the youth has discharge data in Inspire, but there's no discharge date yet from the enhanced website that's been downloaded and added to Inspire. And that will typically correct once they've been entered in the EWS and that data has been integrated. Which is why it's really important to get the data entered in a timely manner so that when it comes time to run a report, everything has had time to integrate and be included in the system. All right, so we've got Betty here. You'll see that you can enter a new interview date, or if you've already done a follow-up and you want to, let's say, go in and change it, you can click existing dates. And if she had one, when she doesn't, it would show up in this drop-down menu, and you could go in and access a previous follow-up interview. So we'll do a new date. Just going to randomly pick a date here. We'll say it's next Wednesday. Click Next. And it will ask where the data came from. So the data for the follow-up can come from any number of sources. We really don't limit that in Inspire because we know at this point different providers have different processes in place, and we really want to include as much as we can. If you have multiple sources, so let's say your agency does a follow-up phone call at 6 months and calls the parent to check in and ask a few questions about how the youth is doing, and at the same time you receive a report from probation. Let's say they run the system and see if the youth is still, has had any new offenses in the juvenile justice system. If you wanted, you could enter that all as one record. You would click, phone call, and you had a report. You spoke with a caregiver, and you had something from the county database. So you can enter all of that in one record if you want. If you do that and you have conflicting data, so let's say the parent says, oh yeah, he's doing great. He hasn't had any new offenses. But then you get this report from the county database that actually says, yes, this youth did have a new offense. When you go through and answer the questions, we want you to err on the side of reporting problems. So in this case, you would report that the youth did reoffend, because although you have conflicting information from mom and from the county report, you want to err on the side of reporting the negative outcome. That said, if one of those sources is more reliable than the other, like let's say nothing is showing up on the county system, but mom says the youth did get in trouble in some way, assuming that it didn't happen in another jurisdiction or another state, you could err on the side of using the county report, because that's probably going to be your more reliable and valid source of information, and you would indicate that there was no reoffense. The other thing you can do is just enter those as two completely separate records. So you could fill out the follow-up screen once for your phone call with mom, once for your report from JPO. The only thing is you can't use the same date twice. So you would need to have different dates for each of those records. All right, so let's just go through the questions here. The first is new offenses. And we tried as much as possible to put the definition and the specific question right here on the screen for you. So you'll see that it asks, has the youth been charged with a misdemeanor or felony, or adjudicated delinquent or criminally convicted for a new offense since discharge? Do not include non-criminal violations of the terms of probation or offenses that occurred before discharge from MST. So based on that, you would answer yes or no. We'll put no here. So again, it's asking for criminal charges, so criminal behavior, so not a status offense or non-criminal violation of probation. And it's asking, has anything happened since discharge? The next question, has the youth had any out-of-home placement since discharge? I think that's pretty straightforward, but as with anything, if you have questions or you run into a specific scenario where you're just not quite sure how to answer a question for a specific youth, feel free to contact the Epicenter and we are happy to help you think through the best way to answer the question. If, we'll say this youth had a placement, if we click yes, then these boxes will be highlighted where we can indicate the type of placement. And it is possible to choose more than one. So really the question here is, which system is placing this youth? So if the youth, let's say, had some kind of criminal behavior and went into detention, we would click juvenile justice. But let's say they were getting in a lot of trouble and they were court ordered to some kind of residential placement, but it's an MA funded placement or it's a treatment. Let's say there was some kind of sex offending behavior. The court's involved in placing that youth, but they're in a treatment program. Then you might click both juvenile justice and mental health. And these are really important questions to stakeholders and to the state. 6 months from now or 12 months from now, how are these youth reoffending? Are they staying in the community? Are we keeping kids out of placement? Behavior and substance use. So compared to how the youth was behaving when he or she was discharged from MST, how is he or she behaving now? Better, about the same, or worse? And again, that would be a question you could ask, and very specifically and directly to the person that you're doing the follow-up with. To the best of your knowledge, since discharge, has the youth used drugs or alcohol? And again, do not count tobacco use. We've made a conscious decision not to include tobacco use here in Inspire, because we start getting into youth who are 18 or are 18 by the point of follow-up. And at that point, although tobacco use would obviously be a health concern, it's not an illegal behavior in the same way that, for instance, using drugs and alcohol would be. So we'll say this youth was behaving worse and there has been substance use. And if we indicate there's been substance use, we're asked, what is the frequency during the past month? And we would indicate what the use is. So if the youth was using for a time after discharge, but now isn't and hasn't been using, you might find yourself selecting no use in the past month. And you can see here where it would be important, if you're doing a follow-up interview or maybe doing follow-up calls or surveys with families, to be asking these specific questions. And there is, again, on our resource page, I'll click back here really quickly, a 6-month follow-up worksheet, which gets at these exact questions so that you could be framing your follow-up to map onto what needs to go into Inspire. And last, what is their current educational status? It does explain here. If they're currently in school, you would indicate what the current situation is. If it's summertime, like let's say it's July when their 6-month follow-up comes, what was the case at the end of the school year? Had they quit school? Were they still in school? What grade were they in? So forth. So we'll say this youth was still in school, and then we can select what grade, say 11th grade. And then employment status is the last item in follow-up. And this is based, the first two, full-time and part-time, are based on paid employment. Full-time would be, on average, they're working 30 or more hours per week. Part-time would be that on average they're working less than 30 hours. Or you can select they're doing volunteer work, or we'll say with this youth does not work. And again, we just hit submit when we're done, and it shows that the data is successfully saved. And again, you can go back and double check that data if you wish by going back to follow up. Now we'll see Betty's in there, and she has an existing date. And if we click that, we can see all of her information and look. It will always say MSTI discharge follow-up has not been integrated because there is no MSTI discharge follow-up. Okay. So those are the data entry screens. Enrollment, discharge, and discharge follow-up. There's not a lot of questions on any of them, but the information is really important for being able to generate the Inspire reports. The other item I just want to touch on before we finish talking about data entry is that there are a few variables from the MST Enhanced website that very directly impact your Inspire report. So it's really important that these are answered the way that we described here or entered correctly. One, of course, is the case ID, just making sure that what you have, if you're manually entering enrollment in Inspire, that you're using the case ID that is generated by the Enhanced website. If you use research group codes, the code P should be reserved for youth who are receiving MST for problem sexual behavior. That's a specific adaptation of MST. So if you are using research group codes for some reason and your agency does not provide MST PSB, you should never be using that code P and come up with some other code. This is because when the reports are run, one of the options is to run the reports by population. And the way that we identify which youth received MST PSB is with the research code P. And so providers who offer MST-PSB will use that code to differentiate the kids who received the PSB adaptation from traditional regular MST. Referral date and first visit date, it's really, really important those dates are entered and they are correct. MST pulls youth into the data integration based on their referral date. So if their referral date is entered incorrectly and it's before July 1st, 2009, they won't show up in the report. And also, if there is not a first visit date in the enhanced website, that youth's data will not be integrated into Inspire. So when we go to the MST Enhanced website and pull the data for download for integration, the MST Enhanced website only includes youth who have a first visit date. So that's another really common issue that comes up where providers will contact us and say, we entered this youth in the EWS and the integration just happened, but they're not showing up in Inspire in the drop-down menu. And oftentimes when we ask them, go back and check, does that youth have a first visit date in the EWS? The answer is no, and that's why the youth hasn't been pulled into Inspire. And again, if those dates are incorrect, you're going to run into issues. So we had a case recently where a provider accidentally put 2997 instead of 1997 for a youth's date of birth. And that results in the average age for clients being a negative number because it looked like the youth was actually born after they completed treatment. So those dates are really important to make sure you get those in correctly. And that's just kind of a really big example of where an incorrect date can throw things off. And the last is in the enhanced website, when you answer the question about the ultimate outcome, there's that question, the youth has not been arrested. We ask that you use the same definition that we gave you on that follow-up screen, which is to answer no. The youth has not been, or answer no to the youth has not been arrested if the youth has been charged with a misdemeanor or felony, or adjudicated delinquent or criminally convicted for a new charge. Don't count non-criminal violations of the terms of probation. Don't count incidents that started before MST began. And we did work with MST services to ensure that it was all right that we ask providers in Pennsylvania to all use that same definition when answering this question. In the answer, we have another really great question here about how do you indicate cyber school? And I guess that would be, let me go back here real quick. I think that would be on the follow-up screen. So let's see. How would we indicate cyber school? That's a great one. I believe we would answer that as still in school. If cyber school is an accepted schooling, if they're in a program recognized by their school district, then they are still in school. What we're really trying to capture here with this follow-up question is, are the kids after they're discharged from MST, are they staying in school? Are they finishing school? Are they in some kind of program? Or do we have kids who are really dropping out and floundering? So if they're in cyber school, it's something that their school district recognizes. We now have the Pennsylvania cyber school program and so forth that's becoming much, much more common. You can indicate that. If they're being homeschooled and they are still participating in an educational program, I guess that would really be the way to define it. Are they involved in a recognized educational program? Attending school, cyber school, homeschooling, assuming, they really are being homeschooled and it's not being used as, the kid says, oh yeah, I'm being homeschooled and nothing's going on. They're actually truly being homeschooled. You could answer still in school for that. Great question. So we're going to move on to talking about how to run the quarterly reports. Before I do that, because some folks, if you're listening into the training and you are not going to be running reports, you might not want to hang out for the next half hour and hear about them, although you are certainly welcome to do so. So before you hop off, if you're not going to listen to the report part, I would just add, let me kind of jump ahead here. If you need help at any point, again, there's that report problem link in the Inspire on both the login page and once you're logged in the top right corner. You can always contact our main office. Generally, the main office is the number for our administrative assistant. This is her email and phone number. She will generally just forward the questions to me. So you can email me or call me. Email is fastest for sure, and I'll get back to you as quickly as possible. But I get lots of emails and phone calls with questions about how to handle a situation, or why aren't youth showing up and so forth. I encourage people to use the online resources first and see if the answer to your question is there online. But if not, or if you're still confused, please don't hesitate to contact us. All right, so back to quarterly reports. So just a brief overview of how the quarterly reporting works. And I guess to back up briefly, in Inspire, there is the ability to run reports both on a quarterly basis, or you can do multiple quarters and run annual reports or so forth. You can really do different combinations of reports. So what I want to talk a little bit about is the process for doing quarterly reports, because each quarter providers are expected to submit a quarterly Inspire report to the epicenter. That's part of the expectations of the funders at the state level. So how does this quarterly reporting process work? The epicenter will send out 3 emails each quarter, and they're sent out from me. They're sent out over the course of several weeks, and the way that we send them out is we send them out in such a way that they coordinate with the data integration dates. So the first email we send out is for step 1, and it's just a reminder to sites to make sure that all of your data for the quarter is entered. I usually send that a couple weeks before the quarter ends and just say, remember, you should have everything in the enhanced website no later than the 5th of this coming month, and make sure you've got all your Inspire data in for the kids that are served this quarter. And when you get that email, that's all you need to worry about. Make sure your data's in there. Then we send out an email for step 2. At this point, integration will have occurred, so all the data that you entered in that past quarter in the EWS should now be in Inspire, and it's time to run your report, and we want you to look it over and make sure it's accurate, and if there's any errors, figure out why and correct them. There is going to be another round of data integration before your report is due, and the reason we set it up this way is sometimes the Inspire report will have an error in it because of something that's in the enhanced website. And you need to go back and correct that in the enhanced website. But then that new data that you've corrected in the EWS needs to be pulled into Inspire, and that's not going to happen until integration occurs. A great example is the one I mentioned before with the provider who was getting that their average youth was negative 21 years old. They run their report here in step 2. Okay, something's off. It's showing our average age is negative 21. What's going on? We figure out the problem. Hey, you've got one kid whose date of birth is wrong. So now they go in and fix that in the EWS. They have time to do that because they've looked at their report ahead of time. They've corrected the error. They contacted us for help because we needed to help them identify where that problem was coming from. And now, when data integration occurs again right before reports are due, their average age is looking, more reasonable. It's looking like the actual average age. So step 3 is to submit your report. So we send out an email and say it's time to get your report submitted. please do so between the date of, when you got this email and this deadline. It's usually the 14th of the month. I typically send those out around the 10th, so you'll have about a 5-day window to run the final report and submit it. The protocol and the dates for doing all of this are on that resource page that I showed you earlier. So you'll see, I think it says like report submission protocol or something to that effect, and it gives the windows of dates for when you should be getting your data in, reviewing your report, and then submitting it. A couple of other just things I want to mention. One is that reports cannot be submitted early. So if you get this email saying check your report and see if it's accurate, and then you send it to us right away, we won't be able to accept it. We need all of the reports that are submitted to come after that next round of data integration so that everybody's running their report off of in kind of the same time frame with the most recent data before we then in turn run the statewide report. And along the same lines, if you run your report here at step 2 and you save it and you just wait to send it to us, when we get it, we will open it and look at the date on the bottom of the report for when it's run. So, for instance, this month, reports were due between November 10th and 14th. And data integration had just happened on November 8th. So we want all the reports run after that November 8th data integration. Just in case people have made corrections or changes to their data in the EWS, we want to make sure you've looked at how that's affected your report and that the report is still correct. We might get a report between November 10th and 14th, and when we open it up and look at it, it was run back in October. So in that case, we will email you and say, we need you to run a report that's current because you reviewed the report back before the most recent round of data integration. So you can kind of save yourselves all that trouble by just following the steps in the, as we send those email reminders. Just coordinate what you're doing with those email reminders. What I need to do next is we're going to look at how to run an Inspire report. I'm going to log out of the system here. All right, so we're going to log in here. Oops. I'm going to log in. This time I'm logging in as an administrator. And you'll notice now, now that we're signed in as an administrator, that this drop-down menu here looks a little bit different. We've got a place to enter some program level data, a place to run reports, a place to change your username and password, and last, I'll just mention this, there's a place to create and delete user accounts. So if somebody from your program needs an account, it has to be requested from an administrator. You cannot have that new administrative assistant or therapist just email us directly. And this is our way of making sure that people who have accounts created are authorized to have those accounts, because once someone can get into Inspire, they have access to client names and information. So you would use this link, create delete user accounts, and it will bring you to a form that you can use to enter those. I'll also just mention before we look at running reports, there is a place here to enter collaborative board reports, and that's if your program has done a report to something like a Communities.Care collaborative or a group of diverse stakeholders that all come together within your community. If you do a report to them, you can enter it here and you would click New Report and enter that information. If you're doing something like a presentation to a single part of your county, a single group of stakeholders, such as just juvenile probation, you would not enter that here. So we have logged in as an administrator. We're going to go to the menu here, and you'll see under Inspire Reports, the only selection at this point is the Data Highlights Report. So you'd select that, and you'll see this screen. Because I'm on the demonstration / test site, this looks only slightly different from the live Inspire site at this point, in that county and referral source are here because we're in the process of developing and testing out the ability to run the reports by county and referral source. So you won't see those on the live Inspire site just yet, but you will be seeing them in the near future. So we're going to go up here, and you would only see, I have here the list of all the providers, but you would only see your own provider agency. Select that from the menu. Under team, again, you would see just your teams listed there so that you have the option if you want to run a report just for a single team. I'm going to select all teams. Once I do that, it asks me to select the population. Do I want the standard population, which would basically leave out all the kids who have that research group P code? Do I want to run it for the MST PSB youth, which would be only the youth with that P code? And again, that code is coming from the enhanced website. Or do I just want to include all of the youth? So we'll just include all of them. And Inspire will ignore what kind of research group code they have. I'm going to do for a single quarter, but if I wanted to, I could run it for multiple quarters. And I would just indicate which fiscal year I wanted and the starting quarter and the ending quarter. So if you want, you can run a report that covers 2 years or half a year. Completely up to you. But when you're doing your report to submit to the epicenter each quarter, you would select single quarter. I am going to use fiscal year 2012-13 because I know there's some data in there for this quarter. And again, it's just testing data, but it'll show us a report so you can actually see what it looks like here. So once I have all that in, for the moment I'll leave county and referral source blank. I'll hit generate report. It will just take a moment to get the report rendered. All right, here we go. Here is an Inspire report. You'll see at the top it indicates all the parameters that were used for that report. And you'll also see down at the bottom, as I had mentioned earlier, it shows the date and time the report was run. I'm not going to get into how to interpret and understand the report at this time. Over on your MST Inspire resources, on that resource page, there is a PDF here called Understanding Your Inspire Report that could be really valuable if you're wondering, if you look at something on your report and you're not quite sure if it's correct, looking at this resource to see, well, how did Inspire come to that number? How did Inspire calculate that for the report may be helpful. And that resource actually goes through in order. So what you see here in your report, it goes through that in order. So the first page of that resource is population served and how are all of these items generated. And then it goes on to the next page and so forth. You'll see here at the bottom is a bar where you can make your report bigger, or you can scroll down and make it smaller. There are arrows here to flip through the report. So I can flip through to page 2, page 3. I could jump to the end of the report if I want. And then one really important part then here is saving your report. You would see here there's a little floppy disk that looks like it's from 1980. You can click on that and you can select how you want to save your report. When you're saving a report for submitting to the epicenter, you would save it as a PDF. It will show exporting, and this is just a part that's really important. You will hit save. I am going to save to my desktop. I'm going to call this, we'll just say test report. You need to make sure that you pay attention to where you're saving the report because Inspire will not automatically open it when you've finished saving it. Or yeah, it won't automatically open it. So you'll need to know, that's why I often save to my desktop because I can easily go back to my desktop after and the report will be there. So I'll hit save. Oops, wrong button. Hit save. And there we go. I've saved the report to my desktop. And again, I won't get into all the details of the information that's included in the report. You'll see here it is it's a 6-page report. There's a lot of information there. Like I said, there's some resources online for understanding that information. And we're always happy at the Epicenter to answer questions that you might have about that report, or to help you troubleshoot if something doesn't look correct. All right. And so that concludes our training for today. I hope it was helpful, and please remember that the Inspire team at the Epicenter is always here to assist you and to answer any questions that you might have.